Hi, Tara. It's so good seeing you today. Hope that you're doing well. I want to say that 2022 was a great year because you were president of
Oh,
AHPM. And so, just so excited to spend a little time with you today and hear a little bit about your experience and think about our future. 2022, a lot was going on, and want to just have you reflect on that for a minute and tell me a little bit about during your time as president, what can you remember were some of the strengths during your presidency? So just share with us.
thanks, Tammy. Great to see you. Always nice to talk to you. Um, Gosh, it's 25, so it feels like eons ago. But maybe that's good. Maybe that's purposeful why we give ourselves a chance to think and marinate on that experience before we talk about it. So yeah, I started in 22, right? So we were really still very much in the pandemic. We had not been together as an academy in 2 years. It was a really tiring, exhausting kind of space for all of us, I think, getting up and going to work and dealing with a really beleaguered kind of community of colleagues. And as an academy, I think we were trying to find our space. What were we going to be as the academy came out of COVID? And so we get towards the end of 22 and things are really opening up, and we get to have that excitement of being able to think about really coming back together. So one of the strengths was maybe unique in that we never used to think about the opportunity to be together as this rarity. We always appreciated it, I think, but great strength was being able to get back together after 3 years of not having that joyous home loving, warm hug that we get every time this group is together. And so that was really a great strength. The other thing that happened during that time that was an incredible strength that probably went under the radar because we weren't together so much was that that was really when we became truly interdisciplinary. We really brought our what we called allied professionals, right? We brought our allied colleagues into the board. So opportunities to be in nominating committee and be on the board and really equalize the role of our allied health professionals into the academy. And that was huge. Really big change that I think kind of maybe went under the radar. And then, the other thing that struck me as a tremendous challenge that we now, 2 years later, I think it was a strength that we realize now was a strength is that the year that I was president and we were, and in the year or two before that, I was very active with nominating committee and the roles. And what we were seeing was an incredible amount of engagement from our membership. So the challenge was coming to nominating committee with a huge number of highly qualified leaders who wanted to participate and engage and not having enough roles for them to feel embraced for them. So of course, we could talk about one of the great things for the future is the strength of seeing that and recognizing it. And now, 2 years later, looking back and saying, we were able to do something about that and creating this new leadership development committee that, I think is a tremendous opportunity for us. So those were some really great strengths. And I was happy not to be included in the pandemic presidency list. I was glad for it to come to an end.
Yes, I think I was pretty lucky to dodge that list as well, and thank our presidents that led us through that. I think that one of the things that people don't realize in the presidency is that there's the incoming president's year, there's the president's year, and then there's the past president's year. And so I really think about the presidency as really a 3-year term, as you're gearing up and lots of roles, and being one of the presidents. requires a lot of board service and a lot of um, institutional knowledge of what's going on. And so I think that bringing that to the conversation would be really wonderful for you to so you have a lot of perspective on the academy, and so as you think through the health and well-being of the academy going forward, what do you think our biggest threats are at this point with all of your experience and commitment to this organization that I know you love?
Yeah, thanks, Tammy. It's true. I mean, I think they thought they'd never get rid of me. I was there for a long time. And even before I was on the board, I was on nominating committee, and gee, it's changed a lot and it evolved a lot in the time that I started volunteering. Um, so I would say some of the biggest challenges that we've had have led to an opportunity to be really reflective. And if this group is good at anything, it's self-reflection. So we spend a lot of time thinking and processing, and that always makes us stronger. But the biggest challenges we faced during that time, I think, were really how we wanted to define ourselves coming out of the pandemic. I think being apart and people looking in other directions for support through the pandemic, through so many different challenges, left us wondering, like, what would we look like after the pandemic? Was our role going to be the same? There were new organizational supports within the field and in um, neighboring fields that people were starting to turn to. And I think it was an opportunity for the board and for the organization at large to think about, you know, just as with our decisions to move forward with allied health professionals being full members, like, are we a physicians organization? Are we an industry organization? Are we an advocacy organization, a research organization? And really we're sort of all of it, and more, of course. But I think the threats over the course of my tenure in that, as you say, sort of that 3 year president experience is to is to really think about how we can be meaningful to every member, knowing that we are not going to be what every member wants us to be all the time. And there were some real tensions during my presidency tenure, including, probably the largest one being the most visible one being around the hospice fraud, waste, and abuse article that came out, sort of, I think it was fall of 2022. And it really got people pretty jazzed up, and people, our members, wanted us to do different things in response to that. Some thought we should become sort of a regulatory oversight, sort of have policing powers and authority over the hospice industry. Others thought that's what regulators and lawyers do, and that's not our role. And people were very emotional about it. And I think within the organization, within our academy, members felt victimized at times by not just by the outside world, but by each other. And so it was a very emotional time for many people who feel passionately about our role in providing the best high quality care for patients and families. And as an organization, we really had to think about how we supported people who are working in our field, and also maintained true to who we need to be as an organization. So I would say that was really big. Also the threat of not being able to engage everyone in leadership who wanted to be in leadership. That was really big. And then, of course, how did we bring everybody back together? Of course, also just luck of the draw, the assembly was not in the country that year. It was in Montreal. And so it was sort of a bummer that prevented some people from being able to come together. And, not everyone always realizes that we pick our venues like 5, 6, 7 years ahead of time, and it's not so easy to change them. So we had to weigh some of that. But I'd say all in all, that might have been a minor thing. Really, what I saw then as the biggest challenges were these tensions between the for-profit, not-for-profit, fraudulent activity, which is maybe two separate conversations. And also starting to see people coming out of the pandemic and thinking about what hospice and palliative care was, yet again in a different way, because the field is still so young. And I think many of us who'd been in the field for a while were beginning to think about leaning outside of what might have been the very well defined roles that we saw as we came into the field, which was maybe either academics, community, or hospice, or some combination of the three. And so what we see, right, was more and more people were thinking about, maybe I'm going to go work for a health plan. Maybe I'm going to go into population health. Maybe I'm going to lean into a telehealth platform, all kinds of different things. And really trying to figure out, how do we support our members and be a meaningful source of space and still that same warm hug that makes a member want to continue to pay their dues and come and feel value for their membership, when people are going into things that typically haven't been the bread and butter of hospice and palliative care. So all those things kept us up at night and thinking long and hard. And I think now they sort of become our opportunities.
No, thank you for sharing that. There's so many valuable nuggets in there. You know, who do we want to be? What are the challenges? What being able to think about um, our future in a creative way, and then supporting each other as a community, even when we have difference of opinion, right? And having that solidarity. So, thinking about the future, you've got a lot of experience and perspective in many different ways. Tell me what you think are some of the most exciting opportunities for AHPM in the future as you see it.
Well, they're endless, right? I mean, you never know what's going to come around the pike, but I think we already see some really cool things happening. Some of the things I talked about, the Leadership Development Committee, maybe our average member may not really realize, but for those of us that have been working really closely with the Academy and in the governance of the Academy, this is huge. This is no longer do we say, nope, you're not gonna get to be on the board this year because there were just too many people who are all qualified. Now we can say, let's engage you. Let's think about how we build a trajectory of engagement for you, and how you can feel like you're contributing and supporting and being supported by your field of colleagues. So I'm really excited about that. We also have, right, totally new leadership. So our dear friend Joe Rotella retired, much to our chagrin, but we are joined by Christina Newport as the new CMO of the Academy. So really excited about that. And Wendy Joe transitioned out of the CEO role and into bigger things for her own career. And we have an opportunity to bring on a new CEO. So I think new CEO, new CMO in the coming year, that's going to be really exciting, and opportunities again to just get new perspectives and bring in new voices. And then, I think, gee, it's how many days into the Trump administration of 2025. I mean, God knows what the next year will bring. And I think that the thing that is our greatest opportunity is that our members tend to lean in when they feel uncertain. And so we have an opportunity to provide that strength as a community through advocacy, through research, through engagement with like-minded folks to help support each other through the changing times. And I think that each year we're going to see more and more of our members dabbling in things, as I said, that maybe were not traditional roles. And I think the Academy has a great opportunity to, again, lean on our leaders who are one step into it, two steps in, maybe been there, done that, who can help prepare future leaders and future participants who want to continue to make a difference in the lives of patients and families suffering from serious illness, but may not have the same perspective on what that might look like than we did 5, 10, 15 years ago. So I think we're always evolving, which is our great strength as an organization. And, just this kind of thing, this willingness to look back and learn from the past and not keep doing the same thing year to year is the greatest strength for our future.
So thank you, Tara, for that. Just incredible insights, and as we say in the business, thank you for your service to HPM, and look forward to more opportunities to hear from you and others that have been in this field for a long time, and are hopeful that we will continue to evolve, and that we'll do it together.
Of
So
course, Tammie, anywhere
fabulous.
you're going, I'm going.
Can't wait to see you for a hug.
See you
Okay.
for a hug. Great to see you. Thank you so much.